Montgomery County Alcohol, Drug Addiction, and Mental Health Services lost more of its remaining resources due to a lack of funding. This comes after the Board of Trustees failed to decide on new crisis services provided, effectively shutting down the county's mental health call center in May of this year. All crisis calls are now being transferred to state and national 988 centers. 2 News reporter Evan Bales now joins me live in the newsroom with more information on how ADAMHS is adapting to these budget cuts, as well, Evan, as their plans moving forward.
John, when I was at this meeting tonight, it was clear that there were a lot of very difficult decisions being made surrounding budget cuts for a majority of the organizations receiving funding from ADAMHS. I had a chance to speak with a community member following the changes about the ADAMHS board is adapting.
Along with the county being 3 months without its own mental health crisis hotlines, it is also dealing with budget cuts, affecting several organizations across Montgomery County. Michelle Campbell has attended several meetings, wanting to learn more about ADAMHS and its funding process. She says she is disheartened to see the cuts to so many nonprofits.
I hate to hear that we are cutting funding for these programs. They are so valuable to the community, but I do understand that sometimes we do have to cut the budget.
Multiple organizations who receive funding from ADAMHS are seeing massive cuts. One of those is West Care Ohio, Inc. The organization had $283,000 approved in a previous budget, but will only receive $34,000 of that funding. That's an 88% cut. St. Mary's Development Corporation is also seeing a dramatic slash of cash, a near 90% cut, and now will receive just $9,000. ADAMHS officials say rising costs due to inflation is partly to blame, as well as grants that they no longer qualify for.
Unfortunately, this is the reality of getting funding from the government and levies and human services money. Sometimes those dollars are not always available.
When asked for an interview, ADAMHS declined.
Despite ADAMHS not emerging with a new contract for someone to fill the hole that the previous crisis service left, they are planning on working with more local providers to help compensate for the loss of those services. In the newsroom, Evan Bales, 2 News.